Over the past 2 decades, we've seen major policy strides towards greater equity in healthcare, but little actual progress. Racial and ethnic inequities persist, in large part due to a lack of clear pathways for translating promising approaches into real change. Factors include weak policy implementation, continuing racism, a tendency to focus only on treatment rather than prevention too, continue to create serious roadblocks. A conceptual framework from the 2024 National Academies Report, Ending Unequal Treatment, inspired specific recommendations for turning ideas into action. The framework recognized 5 influential external forces that act individually, intersect with one another, and constantly interact with domains in the healthcare system. Structural determinants of health, such as policies that affect social and economic needs. Oppression and structural racism, enabled by historical and continued policies such as residential segregation. Social determinants of health, such as access to transportation, that disproportionately impact minoritized populations and manifest as unmet health-related social needs, including unemployment, which many healthcare systems are unable to address. Non-healthcare sector partnerships with social service agencies and others that can shape priorities and programs. And societal commitment to remove barriers and create equitable access to resources. Collectively, these forces interact with 4 key domains within the healthcare system that ultimately intersect within local communities. Healthcare laws and payment policies are at the heart of persistent barriers keeping all individuals from receiving equitable healthcare. Healthcare service delivery focuses on quality, culturally sensitive care for all, and considers issues such as workforce, clinical decision-making, integrated health and social care, health literacy, and more. Discovery and evidence generation includes the levers needed to implement, evaluate, and enforce strategies to eliminate racial and ethnic healthcare inequities, advance healthcare equity, including research, funding, data, and infrastructure, to name a few. And accountability involves legislative oversight to ensure that laws have their intended impact, and systematic standards and procedures are in place to enable reviews of implementation, effectiveness of interventions, and more. Together, we can create a system that achieves healthcare equity and promotes optimal health outcomes for all individuals regardless of race, ethnicity, or other demographic factors. Learn more about specific recommendations within this framework at www.nationalacademies.org/ending-unequal-treatment.